Thanks for clicking into our Zoom session on Introduction to Farm Stress, Mental Health Needs Among Diverse Farm Populations. My name is Thomasine Heitkamp. I'm the director of the Mountain Plains Mental Health Technology Transfer Center and the Addiction Technology Transfer Center with our collaborators at WICHE in Boulder, Colorado, and the University of Nevada, Reno for the ATTC. So I'm really pleased to welcome you today. Good afternoon to our Eastern Time and our Central Time folks, and good morning to our Mountain Time and Pacific Time folks. So we always try and remember that it's different time zones, and we think we're probably serving people across all time zones in the United States today. I'm really thrilled to have you as part of this session and to welcome you. But before we get started, a couple of really quick housekeeping items. We will be recording this webinar. So it will be recorded. The chat box will not be in the recording. Neither will the question and answer part of the event be part of the recording. And this is something we share on our webpage, and we'll send you all the links so you can push it out to your friends who couldn't attend today. Please feel free to ask questions in the chat box. David Terry, who welcomed you as well as myself, is waving at you now. If you have a video open, will be monitoring the chat box. He will be including additional resources in the chat box, so follow the chat box. We will unmute you for the Q&A section of the presentation, and that will be at the end of the training. And we will have a link for some evaluation that we ask you to complete. All the trainings that the Mountain Plains Mental Health Technology Transfer Center and Mountain Plains ATTC centers do are free to the public, but we do ask that folks evaluate the training if possible, and so we appreciate that. And it shows that we're doing our job. Any questions, concerns about tech? David is ready to help with tech if you haven't used Zoom before. So he is the person waving and always helpful. The presenters today are Dr. Shonda Schrader, who's a research associate professor at the Center for Rural. He will be joining me in presentation along with Matt Purdue. And Matt is an agricultural and policy strategist with the North Dakota Farmers Union. He just moved back to North Dakota. He's living in Jamestown from Virginia, and assures us that he's had many folks asking him if he's staying warm with that Virginia license plate on his car. They're worried about his well-being, that he's not accustomed to the cold, but he's from North Dakota. I see you unmuting if you want to say hi, Matt.
Hi, everybody.
And Shonda Schrader will be getting us started. So our next slide is about the agenda. And I think Shonda's moving slides, right? All right. What we'll be doing today is really an introduction to farm stress, an introduction to the basics of what's occurring among our agricultural community, and the front page of our newspapers. As I read yesterday, that Salvation Army donations are down. We're going to be talking about how to deal with some of the farm stress, some of the very basic information, and how to think about doing some basic kinds of things like depression screens and reach outs in our agricultural community. The Mountain Plains Mental Health Technology Transfer Center, I mentioned that we do free training, and we serve individuals with mental health disorders, especially those with serious mental illness or serious emotional disturbances. We work in 6 states, although, David, you want to talk about the poll? It looks like we have people from outside our states in the poll. So we had you indicate which state you're from.
Yeah, so it looks like the results of the poll that I just closed, about half of the people are from within our region, a little under half, so it looks like 48% are from Region 8, and then 52% are from outside of Region 8. So we've got really good representation across the country. And then, unfortunately, I had meant to make the second question a multiple choice option, but it looks like it was just a single choice option. And the #1 thing that people are concerned about related to farm stress is stigma related to seeking help.
Thanks,
Yeah.
David. And you will see those states, North Dakota, South Dakota, you will see Montana, Colorado, Utah, and Wyoming. So we serve a very rural area, and our focus is on rural communities. Each of the mental health technology transfer centers have an area of focus, and our area is rural, and so that's why we jumped in on the farm stress issue. And I just want to say that HRSA just did a wonderful session on farm stress, and we got some nice ideas, and I see Kim is on today. Thank you for joining us, and hoping we can build on what you've done with HRSA on farm stress, as some of our federal grantees and federal agencies are really working to try and get the best resources out to people working in communities that are struggling with farm stress. So we will focus barriers, reach entry-level professions. Our focus really is serving providers. And we try and use good technology to do this. You'll see today that we're using a Zoom session. We had a couple hundred people registered for this using a Zoom link. So we really work to use those technologies and the polling that you just saw from David. So we're really going to highlight how you can use tech and models. The disclaimer, we need to do this because we're funded through SAMHSA, the Substance Abuse and Mental Health Services Administration, and this is part of funding from their grant. And the opinions expressed herein are the views of, oh, I guess we got the wrong name on there, Stephanie Winfield, MSW, and Sarah Young. But these are the views of Matt Perdue, Shonda Schrader, and myself. So these are our views. We use a template, so you can see that we have gotten a good start on addressing some of the issues in agricultural production. So at this point, I'm going to turn it over to Shonda, who's going to get us started. Dr. Schrader? You're muted.
All right. Is that audio better? All right, I see head nods, great. And I'm actually turning it over to Matt anyway, so sorry for that glitch. Matt's going to kick us off with a little bit of background about our farm producers so we can understand how our regions actually differ and how we have unique needs in all of the different regions of the United States, and a little bit about the difference between farmer, producer, ag worker, and the different language we use. So go ahead, Matt.
Great, thanks a lot, Shonda.
Oh, and now Matt's muted. It looks like it's contagious.
Am I unmuted now? Great. So before we really get rolling into, understanding farm stress, to Shonda's point, it's really important that we understand who our agricultural producers are, and why, agricultural producers in our region are unique from producers in other regions. So a lot of this is going to be data from the 2017 agricultural census, which is published every 5 years. The first piece here is the number of farms in the country. So every dot on this map represents 200 farms. What you'll notice is that when we look through what we refer to as the Corn Belt, the Great Lakes region, you have a higher density of farms. It's important to note that this is not necessarily a representation of the amount of agricultural land. And so as you get further west into our region, you're looking at fewer farms, but really wide swaths of agricultural land. And so when we look at the farming population, there are about 2 million farms and ranches, about 3.5 million farmers. 2/3 of our farmers are male, about 1/3 are female. One of the interesting things with the 2017 census is that it collected information on decision-making on the farm. And so for the first time, we were really able to gather more information about who actually is engaged beyond the principal operator. And so the 2017 census had a lot higher female representation and really illustrated the role that females have in our farming system. The average age of farmers is about 58. So we're looking at a rather old population, and about 75% of farms have internet access. So when we're talking about telehealth, telemedicine services, we still have 1/4 of our farming population with no internet access. Many of those 75% probably do not have high-speed access. So when we look at the beginning farmer population, about 1 in every 4 producers, 25%, is a beginning farmer with 10 or fewer years of experience. And that's an important thing to think about when you think about farm stress. What are those stressors that are very different for a beginning farmer than those that an older farmer, an established farmer would face? Again, 56% of all farms have at least one female decision maker. The percent of producers where farming is the primary occupation is the highest in the Midwest. And so what that means is, of the 2 million farmers in the country, or of the 3 million farmers in the country, many of them have principal occupations other than farming. They get their income from their primary income from a source other than agricultural production. And we need to recognize these regional differences in order to develop resources and provide care. The stresses, the workloads, the financial situations are very different for different sectors of the farm economy, and it's important that we acknowledge those differences as we work with producers. So again, here you can see that those reporting farming as a primary occupation is actually, it's a pretty high concentration in our region when you compare it to other regions in the country. So when you look at that dark blue, you're seeing about 60% or more of those producers are reporting farming as their primary occupation. The average age of producers. So we said the average age across the country is about 58. When you look at this map, you can see that you have older producers more concentrated in the Southeast and the Southwest. In our region, we're actually a bit younger, tend to have a bit younger producer demographic. However, it's important to note that the spread we're looking at here is under 56 to 60 and over. And so you're still seeing a population that is older than the average worker. Percent of producers 65 or older, don't call them retirement age, 65 or older, really concentrated again in the Southeast and the Southwest. Again, our region tends to have a lower percentage of producers who are 65 or older. And female producers, what you see here that's really interesting is that female producers tend to be more concentrated along the coasts and in the Intermountain West. And another piece of information that we found through the Ag Census is that female producers tend to be on smaller acreage. And so when you look at those coastal operations, you're oftentimes talking about direct to consumer sales, direct marketing operations, farmers markets, and things like that. White producers, this is, long been a statistic that's been cited, but, when we're looking at the farming population, we are looking at a population that's predominantly white, particularly in our region. In the Southwest, you see a population that has more Latino farmers. In the Southeast, you have a population that has more African-American farmers. You'll notice that in our region, you have a few places where there are less than 75% white producers. And I think it's important to acknowledge the native farming population that has a significant presence in our region. So now that we have a general snapshot, a pretty quick snapshot of where we stand among the agricultural population as a whole, it's important to understand some of the unique factors around farm stress. So when we define farm stress, I think this first bullet is really, really important. There's a lot of stigma around these conversations, and folks tend not to, the farming population in particular, tends not to want to talk about their feelings, about their mental health, about their emotional well-being. And what we've done as a default is focused a lot of the resources around farm stress as on financial factors, financial issues. It's really important that when we are talking about farm stress, we differentiate or we view it as a term that includes different aspects. Financial stress is certainly a contributing factor to farm stress, and I think in a lot of cases can be a driving factor, but the farm stress, the stress that the individual producer, that the worker, that the family faces is different, is distinct, and we need to make sure that we are treating these people as individuals not as, economic drivers. And so when we talk about farm stress, it can be experienced by the farmer or producer, that's the manager, owner of that operation, by the agricultural worker, those who maybe don't own the operation but are working on that operation day in and day out, or the farm families, the families of those agricultural producers. Farm stress is the stress experienced by farmers and their families as a result of the unique agricultural work environment. And again, remembering that each farm has a unique environment in and of itself.
Thanks, Matt. I am going to jump in now and talk a little bit about contributing factors. Some of the things that contribute to unique stress for our farm communities, and I know we just got done establishing that regionally there are going to be different stressors. There's going to be different stress depending whether you own the farm or you're an agricultural worker. But I'm going to take a step back and now talk a little bit about some of the factors that contribute to farm stress more generally. And sort of as Matt spoke to, when we talk about farmers moving forward, we really are trying to include this as a more general conversation, to include farmers and ranchers and those who own and operate and even work with farming communities. So some of the things that contribute to the additional farm stress is the uncertainty and lack of control over all of the outside forces. And this includes weather and natural disasters, tariffs and commodity pricing. This community is really sort of at the mercy of these things that they cannot control, even if they had wanted to. And so that makes the profession a little bit more difficult. They experience financial pressure if they are an owner. There's the debt load, the equipment repairs and upgrades, the product value, and extreme outdoor work conditions. This includes having to work outside upward of 14 to 18-hour days, depending on what particular needs there are at the farm at the given time, and having to do it in either very frigid temperatures or very hot temperatures, and having to do it over long periods of time. And then that feeds into this fatigue and excessive workload. And keeping in mind that some of these stressors, if you talk to somebody who works maybe an 8 to 5 in an office setting, and you tell them to drink more water and sleep more at night, that might be a little bit easier to give as advice than to somebody who absolutely must milk or absolutely must be in calving season. And you can't give the same sort of recommendations to improve stress and mental health as you could to someone else. And then again, we will reiterate this several times, but the stigma around help seeking and the lack of mental health resources. And we'll share some slides coming up here about the actual access issue and what kind of things are being done to address stigma. So additional contributing factors, access to relevant care. There is a lack of behavioral health workforce in rural areas in general, but there's also a lack of preparation from primary care providers. And so this is what we mean by relevant care. Because even if we can provide access to providers, can we ensure that those providers are aware of the unique attributes of farm stress and the unique considerations in working with farm families and communities, even in the types of services we offer or the time of day we offer them? Some of the things that are lacking in the preparation for primary care providers that really could be an opportunity to address farm stress are the topics of depression versus toxic reaction to farm chemicals, recognizing agricultural medicine. There are currently only 6 textbooks on this topic. And then really addressing agricultural behavioral health, sort of what we're trying to do here today, talking about those unique attributes. And there are currently no textbooks on that topic. And so it honestly is not because of lack of effort on our primary care providers' side of not wanting to know this information. That information just isn't always readily available. So these are the health professional shortage areas from 2019. The dark blue you can see are whole county shortage areas. And this doesn't exactly make the case that rural are worse off than urban, but it really makes the case for the fact that not only do we have shortages in rural areas, but we do in urban as well. So even if we have strong referral practices, there's not necessarily even anywhere to refer them to in those urban centers. Additional contributing factors. So not all farm stress is the same. And I know Matt alluded to this, and we'll speak to it a little bit more again later as well, but farmers and owners are going to experience variable stress compared to an agricultural worker or a seasonal workforce. We are not saying that one experiences more or less stress than the other, but the type of stress they're experiencing is different. And it's important for providers and individuals and communities that work with farm communities to recognize the difference between the two. So one region might be facing drought, while another region is experiencing flooding, and being aware of those circumstances can benefit the care provided. There's also a lot of difference between the daily stress in milk production or the seasonal stress of crop management or calving. And we really do want to stress how important it is, especially in primary care, to recognize some of these outside forces, because setting scheduled appointments during high production season or crop, when you're trying to work extended hours and you may have to be in the fields through the dark, through the night, the type of recommendations you're giving for self-help or to seek better sleep, it's not going to be a recommendation that can necessarily be followed while also meeting the demands of their job. So now we want to provide for all of you some physical symptoms and some emotional symptoms of farm stress. And the first slide, these are symptoms that, as somebody who is not the farmer, we can't necessarily identify these in the individuals that we love, know, work with, or represent. But these are things that we can inform farmers to keep their mind open to. Are you experiencing any of the following physical symptoms of farm stress? And what's difficult is that as you are looking at the slide, and I'll read a few of them to you, is that a lot of these can be attributed to just workload in general. And so that's a little bit about literacy and addressing stigma and helping our farm communities to recognize these as symptoms of farm stress and not just symptoms of a hard work day. So some of these symptoms include muscles are tighter, more tense than general, aching heads, upset stomach, shortness of breath, excessive and low energy, fatigue, and this is fatigue beyond the normal tired from working a full day in the field. High blood pressure, increased heart rate, poor sleeping patterns, an increase in illness and ulcers. And like I said, a lot of these things we can't recognize in somebody else, or providers may not be able to recognize unless they self-report. But we really can help with some of the behavioral and emotional symptoms. Be watching for some of these signs and see if there's any indication of farm stress. The behavioral and emotional symptoms that you can look for among a farming community to see if they may be experiencing farm stress include low self-esteem, memory loss, lack of concentration, an inability to make decisions, anger and depression, loss of their normal spirit or humor, so sort of a change in their personality, which can also be manifesting in acting out and withdrawing from their friends and family. They could have increased irritability, higher anxiety, drastic changes in their eating habits outside of what might be required for the job at the time, using substances or increasing use of substances. This includes tobacco or alcohol. And if they're having difficulty controlling emotions or growing exceedingly impatient. Now this slide comes from the National Institute of Mental Health, and these are signs of clinical depression. I'll review these briefly, but then I'm going to turn over to Thomasine, who's far more expert than I am on the topic, and she'll share with you some actual screening tools that can be utilized personally and professionally. Some of these signs of clinical depression, it's encouraged to know that if any of these symptoms last for longer than 2 weeks or begin to interfere with your typical work day, that's a time or an opportunity to seek help. The signs of clinical depression that we utilize, including among farming communities, are to be persistently sad or anxious. And you'll see that several of these signs of clinical depression were already listed in the previous slide addressing behavioral and emotional symptoms of farm stress. So feelings of hopelessness and pessimism, guilt or worthlessness, loss of an interest in their normal hobbies and activities, that extra fatigue or slowing down their normal behavior, difficulty concentrating, making decisions, difficulty with their early morning waking, oversleeping, having a change in their appetite or their weight, either direction, thoughts of death or suicide, any attempts, restlessness, and then persistent physical symptoms like we spoke about previously. And now, Thomasine, I'd like to turn over to you to talk a little bit more specifically about some self-assessments.
You bet. I hope you're hanging with us today. What I would like to say as a social worker who's done farm stress work, and I'm old enough now to have been through the 80s and the farm stress of the 80s, is that we have a lot more tools right now. We have online screening tools. We have an internet that's more robust, even if it's slow. So we have some capacity as behavioral health providers to really have those conversations and to know a little more about having conversations. But it does require on our part to understand ag. And what is ag about? So if I have a family member that needs to drive quickly to get back to his farm because he now has propane to dry out his corn, to understand what that means in his world of harvest, and a harvest that's running late, and really understanding some of those economics. And we're going to talk about subsequent sessions that will provide that for you. But a general immersion in understanding agriculture and the lives of farmers and farm workers as well, and ranchers, so that we have a more robust understanding. But the one gift that I'd like to give any behavioral health providers working with farm stress today is to ask the question. What I have in front of you is the Patient Health Questionnaire 2. 2 questions to start that conversation. And as my colleague who's on today, Meredith Shogun, who does a lot of screenings at an FQHC, said, just encourage them to start that conversation. And you can even do it in a informal way. During the past 2 weeks, have you been bothered or feeling down? Are you feeling depressed? Are you feeling hopeless? In the past 2 weeks, have you been bothered by little interest or pleasure in doing things? And it is also okay to ask, do you have thoughts of harming yourself? It's okay to ask that question and to get a sense. And if they're responding yes to those questions, the importance of making a referral, and in those rural communities, to their primary care provider, to their family practice provider, their family nurse practitioner, to a provider in that community that can do additional screenings. There are other screenings, Patient Health Questionnaire 9, that they can develop. But this slide is really a reminder to do that assessment. And you may need to do that while they're milking cows. And you may need to do that if you can hop in a combine while they're harvesting. So really being in a place where you can do that quickly and efficiently and in a manner that feels comfortable to the farmer and or the farm worker. The next slide I find very interesting, and this is through mental health screening tools. And it's very easy to use. I tried it, and it's with Mental Health America. It's one of many resources that you can use. Something else that David Terry is going to put in the chat box that we do a lot of is screening, brief intervention, and referral to treatment. There's some really easy questions to check into substance use and responses to substance use. Again, your primary care provider should have those screening tools on site, make that referral. So that's a very important part of the process, is to do the screening, but most of all, have that conversation. I think, Shonda, you pick up some conversation now about farm stress suicides.
Yes, thank you. So we are trying to now move into a conversation around farm stress and suicide. I do want to discuss a little bit that I saw a comment related to the financial stress and the idea that we need to remember that the financial stress plays into this, if not the most significant contributor. And I do want to clarify for Denise that yes, we were trying to make clear that a lot of the resources, they discuss farm stress and limit it solely to financial stress. And we're trying to just drive home the fact that yes, we all recognize that finance is going to be a significant contributor to someone's mental health. We're trying to say that we don't want to limit the conversation of farm stress to only being financial stress. And we want to expand that conversation to encompass other mental health stressors. So thank you. And I hope that offers a little bit of clarification. So thank you for that, Denise. As we move into farm stress then and the discussion around suicide, is that we really wanted to lead in with this notion that the media began reporting that suicide risk for farmers was higher than any other occupation. And this was really covered pretty widely in the media. And it was based off of a CDC report where the data were then retracted and revised. A lot of it because of this conversation that we've all had at the beginning, where we really needed to make a distinction between farm owner and agricultural worker. And it was simply just an error around including or excluding individuals from the data set. I'm not going to go into significant detail around that data discrepancy, but the reason I do that is because so many groups and agencies have done a lot of work around that data point. And I think it's great that even though there was an error, the error maybe overrepresented suicide risk because the rates are still high. And this error sort of happened at the right time to draw attention to an issue that still exists, even if it's not at the rate that the initial data included. So the error really occurred under this triple F occupational group, which included farming, fishing, and forestry, but it didn't include self-employed farmers, and it didn't include those ranchers and agricultural managers. And they were actually included under a different category of management. And so once they revised the data, it turned out that farming was not the highest risk category any longer for suicide, but the rates are still high. So this is the updated CDC report. I included this snapshot simply for those of you who may want to access the slides at a later time and to dive into the data a little bit further. I provide the URL for you there to the CDC report. But really what the data indicate is that the rates are still high. So it's no longer the #1 occupation for suicide, which is what all of the media sort of ran with and reported after that, after the CDC data were available. In fact, among all males in 2015, the top 3, once they revised, were construction and extraction, art and entertainment and media, and then installation, maintenance, and repair. And then they indicated that there really wasn't an increase in suicide rates among farmers from 2012 to 2015. But more importantly, in my opinion, is that suicide rates are still much higher for farmers than for all working-aged adults. So specifically, from 2000 to 2015, the suicide rate among working-aged adults increased by 34%, and it increased to 17.3 suicides for every 100,000 working-age adults. But now if you look at the farm suicide rates for males in the farming, ranching, and other manager occupations, so this is the revised data, the suicide rate was still 32.2 in 2015. Now think of that number again compared to all working-aged adults, which had increased by 34%, and farmers are still much higher than that rate. So for males in the ag worker category, that rate's a little bit lower. It was 17.3 in 2015, but it's still at that national working-aged adult rate of suicide. There are warning signs of suicide that are a little bit different than the warning signs we talked about earlier for depression and clinical depression and farm stress. And some of the general warning signs for suicide are having conversations and talk of suicide or having a history of suicide within the family, an increased use of drugs or alcohol among the individual, if they are giving away possessions, obtaining firearms, if they begin to withdraw from their friends and their family and are exhibiting aggressive or disruptive behavior, if they stop taking medications, or if they show a preoccupation with death. I do want to mention that you do not need to check every one of these bullets to be at risk of suicide, and that if you know somebody who's under stress and exhibiting any of the other symptoms we've talked about today, and they have even one of these bullets, it's really important to begin that conversation and offer resources. And we're going to get into what I consider the more positive lens of this presentation today, which is the actual resources and things that are being done. And first, I want to give you a teaser of why so much work has happened. So I know I already mentioned previously that though the data were wrong, they did do something positive for this work, and that is that they grew attention around the issue of farm stress and farm suicide. And when the media pick up a topic, People get engaged, which is fantastic. And then you start seeing federal resources and state resources and coalitions and groups coming together to address the issue. And the data that we were just showing you were for 2015. So it doesn't tell us what's happening today in 2019 among our farmers and our ranching communities. But something that can tell us a little bit about what's happening might be the way that the topic's being covered in the media. And so what I did is I'm going to just click for you very quickly a couple of headlines that have been in the news in the last 2 months. And I think it's important just to see the reach of all of these different media releases. So we see here that Northland farmers are feeling the mental health challenges of their calling. The state of mind, farmers are managing stress during harvest as suicides rise. A tough season takes mental toll on farmers. When farm stress hits home, the stress is unbearable at times. Farmers wait and hope as weather delays their harvest. Faith coalitions are being formed to help farmers as stress mounts. Free farm stress training sessions begin today. The CDC, farm stress, suicide, a rising rural health concern. This is a 2019 headline. So the CDC, even though the data from 2015 were adjusted, they still recognize this as a growing health concern. Suicide on the farm, how one man is trying to save lives. Trade war, weather, low prices increase farmer calls to the Extension Suicide Hotline. Farmer suicide rates, mental health draw conversation. Suicide in farming, industry called on for mental health support. Mental illness on the farm, growing trend hitting farmers and ranchers. Drought drives farmers to commit suicide. So now that we've really drawn your attention to some of the press and what's happening, I want to turn it over to Matt to talk about sort of the positive repercussions of all of that attention and some of the work that's now being done to try to help our farming communities.
Yeah, thanks, Shonda. And I think the bottom line here is that all of this media attention really drove a lot of attention, a lot of resources towards developing services that could support farmers in times of crisis. Some of these resources have existed for a long time. Farm Aid was established in the 1980s and has long been, one of the go-to resources for folks experiencing really any sort of farm stress or farm stress drivers. And really the great thing about Farm Aid is what they will do is when you call in, they have farm advocates on their staff, but they can also refer you to resources within your state, within your region. Another member of the Farm Aid network, if you will, is RAFI, the Rural Advancement Foundation International. RAFI does a lot of great work helping folks in stressful times, especially around natural disasters. They really can be a go-to source around natural disasters. They are based in the Southeast and have done a lot of hurricane response that has really informed and strengthened their work in times of really significant natural disasters. When you look at AgriSafe, AgriSafe is another great resource that I know we're going to talk about a little bit more here, but provides a lot of great basic information to producers, also does a lot of great outreach to medical professionals. And so that can be a really helpful resource for folks from a lot of different perspectives, but especially when you're coming from that medical professional perspective. National Farmers Union established a Farm Crisis Center, which really was designed to share out a lot of these resources that we see here on this screen and that we have identified around the country. And then, of course, there's also the National Suicide Prevention Hotline and the Avera Farm Stress Hotline, both of which can be critical resources and are critical resources. And now I'll kick it back to Shonda, who's really going to dive into some of the state-specific, the regional resources, and really dive into the role that Extension can play and things like that.
So I think I'm gonna jump in here. One of the slides needs to be fixed. I just saw in the chat box. We'll fix that. The other thing I would say about this process is that there's many people that know a lot. we don't need a concert like we did in the 1980s to define the problem. We know that there's a problem. And someone put in the chat box, Dr. Roseman, who, you know, has been helping us and guiding us in some of this work, and has and I will put that in a chat box as well, has a lecture that he provided in South Dakota that guided some of the organization for this session. So there's really good experts out there, but and Dr. Roseman has a blog, and one of my takeaways is that we need to really pay attention to some of the compassion fatigue occurring among people doing this work as well, that this can be exhausting work, and sometimes people don't always understand rural and the importance of doing this work in rural communities, and it may involve a lot of windshield time. And just like farmers, behavioral health workers can become fatigued, and primary providers can become fatigued. But one of the resources, and again, I just want to emphasize use of technology, is our land-grant universities that run county extension offices, and many of them, you know, in our region, Region 8, NDSU, South Dakota State, Colorado, Montana, Wyoming, these states have good products that sit on their extension webpage. And this is one that I pulled up that's just full of good information. And this was from Maine, from the University of Maine, but it provides, you know, really important, you know, the 2-question survey that I just went over, the PHQ-D2, and you can look at that, or the PHQ-2, you can look at that, and this would be a resource that you could just carry or put on top of your computer when you do that work. So I think those kinds of resources and the kinds of support that Matt has just presented in terms of addressing some of the specific farm supports that exist are very important as well. And so the next slide really has some extension office resources and tips for managing stress, warning signs of stress, risk hotlines. So this slide deck is pretty dense. And so this will be posted with a video of this training so that you can access that if you need it. It goes on our webpage. We hope that's helpful to you, and really looking at some of those coping mechanisms. But as Shonda mentioned, they may look a little different, right? Because you don't have a water fountain to fill up your big water bottle, but you may have something in the cab of your combine, right, to grab. So thinking about, you know, access and all of the unique issues of farming that are quite honestly very isolating. So you can view, and David just posted a link where you can view the trainings as well. So that's important. I think the next slide is South Dakota. Shonda, I think you're going to talk a little bit about South Dakota. This extension office really does have the Mike Roseman stuff that people have been chatting about.
Yes, absolutely. So while our webinar and a lot of our resources are targeted to anyone working with individuals around mental health, we did want to just point out a couple of the extension centers in our region and provide the URL or the link to those centers. But as the previous slide indicated, all of the extension offices really are starting to drive up a lot of effort around mental health and stress and stigma. And I'm going to just share with you a couple of them and the direct links to what they're doing around farmer stress and mental health. And this is South Dakota's example. And here they're talking about helping farmers and ranchers during stressful times. They have resources from screening tools to frequently asked questions. This is Utah. They have an Ask an Expert, so they provide tips for busting stress. Again, these are really here to be a resource for those who maybe couldn't join us today in the conversation, or for those of you on the call that want to go directly to the URL following today's presentation. But we just wanted to give a quick screenshot so you can see the type of work they do. Their resources are not limited to the one screenshot I am sharing with you. Colorado, for example, has an updated resource about the signs of farm and ranch stress. And North Dakota, they actually include a link to a couple of videos. North Dakota's landing page has a few more resources with podcasts and videos. So that's their different approach to trying to address and share information. Here you see Montana. They lumped their conversation into a bigger conversation about community and family wellness and health. And so I think it's important to recognize that the resources aren't always going to be the first thing on the page, because these extension centers are very large and they cover so many topics that sometimes it does take a little bit of digging to find the specific resource you need, but they are all actively engaged. And then finally, we wanted to share Minnesota's resource for a couple of reasons. We know they're technically out of our region, but we share a border with Minnesota, especially physically located in North Dakota. But the thing that we'd want to drive home is that they even are now including workshops, which are freely accessible around farm stress and how to identify signs and symptoms that you can view at any time. And they're really valuable resources. So we wanted to provide that link as well. And to speak to what Thomasine was mentioning, because our website does include a page about a rural health focus, knowing that there are all of these resources, including additional resources you've all shared in the chat box, which are great, we plan to put those all up on our website, because just as Thomasine said, we're not going to develop and provide and recreate all of this information. It exists. We just want to make it easier to access. And so for those of you who maybe have other things we haven't shared that you think would be really helpful, please do share those with others on the call today and with us, and we'll make sure that once we've reviewed them, and we can put them up online so others can access them as well. Another really great resource that I'm going to actually turn over to Matt to speak to is the Farm and Ranch Stress Assistance Network. And this is a new and great opportunity that I'll let Matt speak to with more detail.
Thanks, Shonda. And so, yeah, a lot of the advocacy at the federal level around farm stress has focused on the Farm and Ranch Stress Assistance Network. By way of a little bit of background, the Farm and Ranch Stress Assistance Network was actually first authorized in 2008, and it was modeled after a regional partnership in the upper Midwest known as Sowing Seeds of Hope. The idea was to establish a network that would connect individuals, farmers, ranchers, farm workers, to stress assistance programs. When that program was established in 2008, it was never funded, and ultimately the authorization expired. And so what we did in the 2018 Farm Bill here this last year is really resurrected the program. The appropriations bill provided a little bit of funding for fiscal year 2019, and we'll talk about the 4 projects that were funded through that. But ultimately, our hope is that this program can get the full $10 million it needs to really get off the ground and start to fill some of these needs. So what types of projects does FirSAN support? So the Farm and Ranch Stress Assistance Network is open to partnerships between state departments of agriculture, cooperative extension, and nonprofit organizations to essentially establish or create a program that provides a menu of options for assisting farmers in stressful times. That's farm helplines and websites, training, including training programs and workshops, support groups, outreach services and activities, including the dissemination of a lot of this really important information and materials. And I know looking through the chat box here and looking through who all is on this call, I know there are a lot of people who work with entities and organizations that provide a lot of these services here. And I think that really speaks to the need for this type of funding, because there's so much great work being done out there that, you know, we really need this federal investment to really boost that and lift that up. So the way that USDA chose to structure the program for fiscal year 2019 was to provide one grant in each region to a partnership of eligible entities. And so there are 4 regions: the Southern region, Western region, North Central region, and then the Northeast region. And within our region, the 2 recipients are Iowa State University and Washington State University, which actually will cover all the way over to Colorado. Again, I think it's really important to note that this is a pilot phase actually of the program. And we're hoping that moving forward, we're going to have much more funding and a lot more projects can be integrated into this broader network to help support producers all across the country.
Thanks, Matt. I'm going to just give a couple of bullets then on some continued gaps and unmet needs. And these are pulled from not only our conversations, but from resources with extension centers and conversations that Thomasine, myself, and Matt have had with other colleagues and entities outside of our own Mountain Plains MHTTC. But some of the unmet needs that are continuing to be seen are suicide hotlines are not always farm specific. And I know we've seen that in our region as well, that calling that hotline, if the individual on the other end, though well-intentioned and well-informed on suicide risk, if they can't recognize the unique aspects of that individual calling from that farm community, it might not be as helpful as it could be. And some of the resources that Matt just spoke to are trying to find exactly that, specific hotlines and chat groups for these individuals. We talked about that lack of behavioral health providers. That's still an issue and something that we're working to address. This idea of stigma and low mental health literacy and trying to find solutions that can actually meet the farmers where they are. Resources, like that next bullet, resources aren't always meeting them where they're at. So we're having this great webinar today, but this isn't exactly the best mechanism to reach our farming community. And that's why the topics are actually a little bit more geared toward individuals who work with our farmers today, but trying to find unique ways to reach them where they're at. And then the gap continues to exist among primary and mental health care providers, not being prepared or trained to specifically meet those unique needs of farm producers and their families. And I know this webinar is really focused on farmers, but there's a lot of conversation around their families as well, and that shared stress and sort of that trickle-down impact on mental health. And then existing resources are sometimes hard to find or muddied in other resources around financial stress and assistance. So what can we do to really make distinct resources and conversations around financial stress and mental health stress and other farm stressors, and how do we provide the care needed? So moving forward, there have been a lot of great ideas and great conversations, and even some of the conferences I've attended to hear what others are doing. There is opportunity to see a lot of progress. Some of the ideas moving forward have been to fund those local solutions and provide help where they are. This might include having coffee programs at a local diner where individuals can just come together and talk and share some of that conversation. Preparing community members to recognize those signs that we went over earlier today, especially those emotional and behavioral signs, because they're already seeing it. The community already sees it among their friends and family members, but they maybe don't realize that those are signs of farm stress or clinical depression. So helping to educate communities so they can see it in their own friends and family members. Developing those farm population specific resources, hotlines and chat rooms that are specifically for our farmers. And working with farmers regionally to identify what their needs are and how they want to receive resources. I know that there have been focus groups being held out of even Minnesota where they're really trying to identify what are your specific needs in this region and how can we best reach you. And a lot of those, what we call qualitative methods, are time consuming, but it's necessary to develop resources that will reach the population. And then training counselors on farm stress and developing those local support groups. Thomasine, did you have other things you wanted to add on this slide?
I wanted to leave time for questions if you had questions. I think the next slide really is a discussion about the upcoming training. The one thing I want to say is I love when the chat box lights up. When and this is a really good part about using tech, is you can chat those comments. You don't have to raise your hand and stop the presentations. But you know, we have about 130 people online today, and several of you bring some talents. And one of the things that we're hoping to do through the addiction technology transfer and mental health is to prepare some materials that identify some of the resources that are available. We know Extension's doing a lot of work with this. So those of you who have resources that you might want to include in materials, that's one of the things that we'll be doing in this upcoming year. So please include those. Some of the suggestions for slide changes we will make, some of the suggestions for other presenters, some of them we're aware of, and some of the resources we're aware of are incredibly helpful. And one of the questions about dialectical behavioral therapy, we have done some training on DBT. We did that in Montana, and that is part of what we can do. Again, sometimes that requires more face-to-face, and we're using tech, but yes, that is in our wheelhouse. All the things that you were mentioning in that chat box are part of what the Mental Health Technology Transfer Center, and I would add Addiction Technology Transfer Center, because we see a lot of co-occurring issues with both substance use and mental health, depression. And so I would like to mention that collaboratively with these two centers, we do bring some resources to be responsive. So we're going to continue this discussion with other sessions on December 9th. Dr. David Flynn's going to be talking about the economics of farm stress, hands-on tools on December 16th. A couple of our folks are online already that are getting ready to present that. Did some good work in the HRSA presentation, and we're folding that into what we're doing. I'd like to do something on compassion fatigue, and then faith-based responses. We're seeing a lot of faith-based pastoral work being conducted in North Dakota, and I hear around the other states. So with that, I would open it up to questions. We have a few minutes left, and I wanted to leave time for any questions. And please complete the evaluation. I promise it's really painless. Just click through that evaluation. It shows that we did this work and provide some feedback to us.